Well, good morning, everybody, wherever in the beautiful world you are. Good morning, good afternoon, good evening, and I hope you are all wonderful. I have with me again the amazing Dr. Jörg Prinz, who's the ex-medical doctor and is now dealing with natural ways of healing the body. And today we're going to be talking about how chronic disease develops and the tools to reverse it. So, yay, I think in a world with so much illness and especially chronic illness right now, it is amazing to be finding tools that we can actually reverse these things, and they are available to us. So, yay, without any further ado, here is Dr. Jörg, our resident expert on health matters here on Solutions with Chanti. Good morning, Dr. Jörg. How are you? How is New Zealand? Looks very dark there.
Yeah, it is already. Yeah. We should have started half an hour earlier, but okay.
I'm
No, all good.
sorry. Are you well?
Yeah, it's a busy life here in New Zealand at the moment. Um, Working with clients, working on the farm. So never a dull moment.
Never a dull moment. Are you on a farm there? Are you a farmer boy?
Yep.
That's
Yeah,
excellent.
we've got a veggie and fruit farm here, a small one. And yep, we're selling our organic products as well.
That is incredible.
Yeah.
Wow.
Yeah, it's
I
a lot of
love that.
work. We established this basically, or my son basically did this, not me. He's the planter, I'm the cutter and the weed eater. So, but the brains is his. And we started actually from nothing. And he planted about, let's say, easily 2,000 trees, um, and established the fields and stuff, permaculture. Yep, quite a job.
Wow. Well, listen, I've just got a veggie patch going here behind my house. And well, actually two, and at my mom's place too. It's a lot of TLC that is needed just to grow for yourself and to boast to my neighbors how gorgeous my carrots are. Then I'll give them a few carrots. you know, but it's
It's,
quite a job, and I mean it's you've got to constantly be composting and tilling the soil. I mean, I'm a farmer's daughter too, but I was more like eating the veggies in the days on the farm than actually planting and taking care. But what a beautiful nurturing thing to do. My mom
mm,
has dementia, and I thought definitely. I mean, I eat fresh, so for her as well. And part of being a farmer's wife herself, growing up on the farm her whole life, part of her therapy for me, I thought would be to have her own veggie patch as well. So I gave one. We made one for her maybe about 3 months ago. You must
mhm.
see that veggie patch growing. It's doing 20 times better than mine. Like we're having competitions here about whose veggie patch is growing the best veggies. But it's amazing. And
Yeah,
that is so therapeutic for her, to go back and have that to do and nurture her veggies. It's
it,
amazing.
it is a
It's
big,
so healing.
yeah,
It's
yeah.
really healing. It really is. Wow.
Fantastic. Mm.
Yeah. Awesome. But we're going to be talking about how to reverse chronic disease. Well, let's first talk about chronic disease. And, what is chronic disease? You've had experience from all walks of life
Yeah.
in terms of this. You've had the medical, the sort of allopathic medical doctor journey as well. And I'm sure there you see a lot of patients who are chronically ill, right? And I guess the only solution really with medicine is like chemicals and cut, slice and dice, cut it out, cut it out, cut it out, blast it out, blast it out. I can't imagine that does any good. But yeah, I'd love to hear your take on that.
Well, as amazing as acute medicine is, accidents, heart attacks, and so on,
Yes.
as poorly as are the results actually in chronic diseases. And the emphasis in medicine seems to be to manage a disease so that people can live long. However, the quality of life is not there, and the healing is rarely happening. So only the medical professionals are allowed to say that they can cure a disease. If I would use that word in my work as a naturopath, I would be in trouble. As much as they are allowed to use the word, they hardly do it.
Right.
So, and that was the frustration for me actually to leave the profession. It was a
Wow.
big part of it where I said no. But I prepared you a little bit of a slideshow to explain all these things in between, because stress is one of the biggest things. And stress is not the same. There are different stresses there. And a lot has to do actually with our emotions, our mind, and a large amount has to do as well, of course, with stresses that come through toxins, medications, and so on. So if you want me to, let's go through it.
That would be amazing.
Okay. So how do I do this now? I start this here.
Yeah.
Can you
I'm just
see
going to
this?
take myself off camera because sometimes it lags if I'm on.
So you can see this energy medicine?
Yeah, absolutely. Looks
Good.
great on screen.
Okay, so the thing is that I basically left medicine because we're doing a lot of chemical work there, but we haven't actually touched energy medicine as widely as I can do this now as a naturopath. So, and there are many definitions around for energy medicine, but basically there are therapies that manipulate energy fields in order to get healthy and heal. So we've got a biophysical energy medicine. There's all the stuff that you can measure in the form of electrons going in electromagnetic fields and so on. But we also have got a large body of therapists who use subtle energy therapies, and they are not measurable. So the biophysical ones that you can measure is, for instance, on electric therapies, is the TENS, transcutaneous electric nerve stimulation therapy. Pacemakers implanted or outside are electrical therapies. Then under the electromagnetics, we have got pulsed electromagnetic frequencies that are sometimes used in some medical settings. Low-level laser therapy, LLT, is something that is relatively new, pushed by one company who was doing a lot of studies and research with it. And then, of course, we have got ultrasound and extracorporeal shockwave therapy. So that's sometimes used in medicine or in physiotherapy and things like that. Rarely you hear something about acupuncture, Qigong, and Ayurveda, or practitioner-mediated energy therapies like Reiki, or Qigong is one as well, overlaps a little bit, healing touch. And when it comes to bioresonance and Rife and Skeena, then usually medical doctors don't want to have a bar of it. But these traditional systems there, they are in place since thousands of years. And I can say in New Zealand, for instance, the ACC, that's the company that helps people who had an accident, they get acupuncture therapy. So if they want to. And so that's a little bit more modern. But I have a feeling that in other places it doesn't really happen. What's often forgotten, and that's where I always put emphasis on it, is our mind, our soul, our thoughts, and our emotions. And I want to tackle this a little bit from a more philosophical side at the beginning. We are born with a self that is basically our subconscious. We have got a few factory settings when we are born, with the DNA from our parents or cells from our female lineage. We talked about this last time. And then epigenetics actually is happening and develops a person, its behaviors and so on. It develops an ego. That's sort of the conscious part of us. And that is formed according to societal norms, of course, plays a big role in it. Now, all these influences from outside, they lead to a process called neuroplasticity. So those nerves that fire together, that get wired together, they then use certain neurotransmitters. And of course, neuroplasticity in a baby also means, because the brain, when at birth, is not fully developed, that it produces more nerve cells and integrates them into the wiring there. And when there is a conflict between the self and the ego, then it causes stress. And these stresses are important. Now, not the stress itself. Every child that grows up has got some sort of stress, some sort of trauma, as it is called today. But we are not so much interested in the actual stress issues itself, but how the body reacts to it and how it will live on after the trauma. Now, I compare what's going on with the ego and the self a little bit like an iceberg. The top part is the ego. That's the stuff that makes that other people see when they meet us, and that's the conscious part. But the subconscious part can't be seen, and the subconscious part plays a huge role in running the body. I will tackle this again a little bit later when we come to the nervous system itself. So these are the factors that make neuroplasticity. And now some people might think, oh, I'm having this, I had these problems, I'm this person, I can't change this. No, that's not true. That can be changed at any age, not all parts of it. So we hardly grow any new nerve cells, except in the hippocampus, which has to do with our memory. But we can use it or we lose it. We can do repetition and intensity and meaningfulness in a certain program, and that actually can change how our personality was until then. Not totally changed, but say improved to the way we want it, not as other people wanted it when they educated us. So that's a bit philosophical. On this slide, we have got not only a self, but a higher self and a true self. And there are certain energies in space that probably contribute to these things, especially dark matter and dark energy. And that has nothing to do with mythology. The dark refers to the fact that it doesn't interact with light, with photons.
Right.
And when the self when a person is sick, then the self having a problem, we actually can get advice from the higher self or from the even from the true self, where the true self is um, described as, well, the memory of all mankind. The higher self probably has to do with a role that we have to play here and has probably to do with previous life experiences. It is all a theory, but as it is put together, it sounds actually quite understandable. We should take note, though, that any thought that we have is coming from up here, from the higher self, from the
Right.
true self. So the brain is basically processing the thoughts that we actually picked up.
Right.
It's a theory, okay? And if there is sort of disagreement between the upper and the lower stages there, then of course that will cause our problems in the physical world as well.
Right. Absolutely.
So conflict causes stress, and then we have got stress between the mind and the heart, and that stress, regardless where it's coming from, whether it's coming from thoughts, whether it's coming from food, whether it's coming from the workplace stress or from outside as electromagnetic frequencies, that causes inflammation. And these conflicts, the mind says, the ego says, I should not eat chocolate, it's not healthy. But the subconscious mind says, tastes so good. So you've lost the battle because the subconscious runs the show and you're eating your chocolate. So you have to train your subconscious in order to say, okay, I don't need it. And that's where the huge problem is that a lot of people struggle with. But back to inflammation. Chronic inflammation causes, I put it in brackets, all chronic diseases, including cancer. We think that it is the main contributor. Whether it's all chronic diseases, we can't say yet. But it's a huge amount of diseases that are actually named that start off as inflammation.
Right.
And if we can tame this conflict and get the mind and the conscious and the subconscious mind working together, driven by an emotion that's coming from the heart, then we can arrange for neuroplasticity, and then we can reverse or improve the situation. Because once this is all gone, and everything, the stress is out of it, then we can improve our physical thing. I'll say a little bit more about this in a minute. Just a quick repetition of what we said last time. This is a hydrogen atom. And what I want to get at is, why does orthodox medicine not look at energy? I don't understand. Because if you look at a hydrogen atom with a nucleus, there's a proton in there and one electron. That's sort of the first one on the periodic table and the easiest one. When you look at this, then we blow up the proton to the size of a golf ball. And then we have to ask ourselves, where's the electron? The electron is still not visible to the naked eye, still that small if you compare the sizes. But we know that the electron zooms around in a spheric area around the golf ball. Now the question is, how it can be close to the golf ball or it could be away from the golf ball. How far away can it be? And the shocking answer is 2 kilometers, which means there's a lot of empty space in an atom. And if you would squeeze out all these emptiness of all atoms that a human body has, then the human would have the size of 30 micrometers. That is the size of a single human cell. And if we would
Wow.
do this with all 8 billion people on the world, would squeeze out the emptiness that is in each atom, we would have a very heavy 500 billion kilogram sugar cube.
Of nothingness.
Now, that's what's left after the nothingness has been pressed out
Right.
of all humanity.
Wow.
So if the 8 billion people would be in there, they would weigh that, but the size of a sugar cube. That's it. So
Wow.
there's a lot of things happening in this empty space. This is an electron probability cloud. That's physics, that's quantum physics. Don't worry too much about the terminology, but there's electromagnetic fields in there. There are quantum fields in there. The electrons in an atom are constantly in motion. Fields inside that space are oscillating. The energy levels shift constantly, and there's interactions all the time. So the atom is not a static thing, it is a dynamic
Dynamic.
entity. And I put some red arrows beside those ones because with those ones we can already work in alternative health. And a lot of doctors worldwide are doing scientific work on those things and try to get it going. But of course, they don't get much support because pharmaceutical companies don't want to sell you electromagnetic fields. They want to sell you medication.
Exactly.
So the energetic body is much larger than the physical body in a human being. And when I talked before about trauma, then we have to look back into our childhood, our relationships in work environment, and so on. And basically, the biography that we have determines our biology because it can go one way that we are resilient, or it can actually make us a little bit dependent on our emotional makeup, how our autonomous nervous system is wired up. Of course, food, water, movement play big roles, and a lot of other things as well. I just picked a few that I want to talk about. Yeah, the list could be endless that influences our well-being and our health, and things that we have to change when we have a disease. So, because of the influence of emotions and our thinking, I do a little bit of what is called energy psychology. This has to do with awareness and forgiveness, and the methods that I use is EFT, stands for Emotional Freedom Technique, EMDR, it's eye movement desensitization, and affirmations play a big role. But this on its own cannot resolve all the issues that keep a disease ticking on. There's much more to it. However, energy psychology like EFT, and this is a tapping sheet here, they actually help you to get acutely out of a negative emotion. And that is something that's so impressive. When I think about when I went to university, we were talking about psychotherapy, and then people go to psychoanalysis for 3, 4, 5 years and they go there regularly every week, every fortnight. And when they come out, and there's a study being done, it's not only cynical by me, but there's a study being done. They're coming out of this therapy and they interview them straight afterwards, a year later, 2 years later. It turns out they went to psychoanalysis because they thought they are nuts, or somebody said they are nuts. They're coming out of psychotherapy. They know exactly why they are nuts. The only problem is they still haven't changed. They're still the same
Right.
as before. So, and this here is so easy. Anyone can learn this within 5 to 10 minutes and can work on themselves or with the help of a trained therapist to actually get you from being in a bad mood and having bad emotions. And you can describe bad emotions whatever you want as bad emotions and neutralize these feelings there. And that helps quite a lot actually for the autonomous nervous system to rebalance quicker. But as I said, there's more to it, but it's a good start.
Yeah.
So basically, it helps you to be happy if you want to be happy. If you are feeling down, you can tell yourself, "Oh, I'm happy," but that doesn't do anything. But if you use energy psychology like EFT, a round of EFT, lift your mood, then of course, you can be happy. It's a bit simplified, but it's a good tool to do it.
Yeah.
So let's look at the influence of the autonomous nervous system there. Until a few years ago, we were talking about sympathetic and parasympathetic. So when we are in stress, then the sympathetic is active. We are in fight or flight mode. And the opposite is the parasympathetic is active, which means we are in rest and digest mode. So these were the two things that we looked at, and we tried to balance the people to be in parasympathetic. Until a guy came along by the name of Stephen Porges, who introduced us to polyvagal theory. So yes, we still have the sympathetic that does fight and flight, but we have got a dorsal vagus nerve, where the vagus nerve used to be thought to be purely parasympathetic, that can, when activated, cause us to shut down, to get into freeze mode or fawn mode, where we are actually submitting to what is going on around us. But then we do have a ventral vagal nerve, and this vagus nerve there, when that is active, then we are socially engaged, or we are able to socially engage. And feeling well in ourselves, feeling well in the company of other people, actually looking for other people, despite the fact that we have got introverts and extroverts and all that stuff. So this is the way where we want to get to. And there are sort of half steps in between there as well. But what I wanted to say is there are 3 different main modes our nervous system can be in, and we try to get to that most of the time in order to feel happy. And when we are happy, then of course we are healing, because you can't be happy and have a disease, or the other way around. If you have a disease, you are not happy. So that's where I'm aiming with my patients. So we discussed before. Oops, something happened with the picture. We have got what I discussed before: an ego and a self, the subconscious and the conscious, that has to do with the comparison of the iceberg, but we have got the same thing with the central nervous system there. We have got peripheral nerves that actually steer our movements and things like that. But the biggest part of the nervous system is the autonomous nervous system. And that is what we try to balance out so that we are able to um, go from a bad situation emotionally back into what's called normal. Because when we ponder about things that have happened in the past all the time, or the autonomous nervous system always scanning
Yeah.
um, for dangers, that is
Mm.
stress that causes the hormones to go haywire and doesn't help us. So the autonomous nervous system is always looking out for what is going on with safety. And if there
Right.
is a hint of something is not quite right, it goes into alarm faster than we actually can react. So you might, some people might recall the situation where they had goosebumps on their arms and their neck, walking through a dark area. Um, the autonomous nervous system has heard something, has seen something, and gives an alarm. And that gives you a physical reaction. The autonomous nervous system also starts laughing way before you have understood the joke somebody just told. So
Right.
that's the flip side of it. But most of the time, it's out there for um, looking for dangers. Oh, here it is. There's something went wrong. Okay. One of the biggest things that I always point out, and I would say 99% of my patients have got that problem, they're not moving around enough. There's a lack of
Mm.
movement. So,
Oh, yeah.
using your muscles works well for the mitochondria, which is the energy factories in our cells, good for the hormones. We have serotonin, makes us happier, endorphins takes away any aches and pains. It works and stimulates the neuroplasticity that I've been talking about. And of course, it does something good for the immune system. And this is the biggest part of it. So, people who come for treatment with me, if they don't do their daily exercises, and it doesn't have to be um, a vigorous training like a competitive athlete would do, nothing like that
Yeah.
at all. But
Walking.
the minimum, yeah,
Walk,
walking, yeah,
walking is the best exercise.
yeah,
It's been shown to be
yeah,
it's actually been proven to be the
yeah.
best exercise just to walk.
So if you don't do this, if you sit on your bum all day and watch telly, it's the worst thing you can do.
I so agree. Oh,
Yeah. So of course, then we've got lots of toxins in the environment, in the food. Don't get me started on supermarkets. Then we
yeah.
have got medication, we've got supplements. Yeah. So we have to try to avoid getting more toxins in. But we can use devices like a Rife machine, for instance, to open up the cell membranes to let good nutrients or
Yes.
necessary nutrients in, and at the same time get the rubbish out and
Mhm.
flush out. A Rife machine is great in that. We
I think,
have,
sorry, I
yeah,
would just like to add to the rife machine there. I mean, obviously we've chatted about the spooky two stuff before, um, and I honestly, I cannot recommend highly enough. And that's just from I'd hardly take any meds. Very, very seldom do I take anything. But the rife machine for me is like just to have it on and and I can see, if there's a little issue in my body, it will sort it out within a day. And I've had
yeah,
it on just sort of, and it's so true what you're saying. But again, it's up to us, as we always say, that we have to keep the balance. And we can't just rely on things to do it for us. It's a tool to help us. We fundamentally have to continue to create a healthy lifestyle. We can't be eating supermarket food and cake and chips all day long and having the rife machine on at night and expecting it to fix everything you've just consumed. That I think, and it's the same thing with medication. I think humans, we fall into this trap. We get addicted to, if it's not, think as a healer, I know how many people get addicted to healers. They think it's better than a doctor. No, it's not. No, you got to be very careful about that. You know what I'm saying? It's like getting addicted to something outside of yourself that you think is going to help you or serve you better than what you yourself can. That's the problem we as human beings have.
Yeah. Yeah, quite frankly, there's only one person in the world who can heal the patient, and that's the patient, him or herself.
Exactly.
So you can take help from others, of course, and it's appreciated by the body and by the mind. Somebody there cares and things. But going there and fix me, doc, that doesn't work.
There's an Afrikaans saying, and I hear the Afrikaans people here say it a lot. There's a pill for elke ding. There's a pill for every ailment, basically. So it doesn't matter what you do. You can just do it now when you're young. When you're older, you can take pills. That's unfortunately a great mentality around that, right? And we don't realize how much damage we're actually doing to our body by putting all those foreign chemicals in, because it's got to be processed by the kidney, by the liver. All the organs in the body have to process those chemicals. And if you're shoving that stuff into your mouth day in and day out, ouch.
Yeah, can't be the right thing.
No.
So, rife machine is a good thing. We can stimulate the nerves. We want to reach neuroplasticity. So, this little device that looks like the remote control for a telly is called a Skeena device. On the back, you can see this has got an electrode, and this electrode stimulates the nerves in the skin. Now, a lot of people cannot imagine how on earth a little machine like this applied on the skin can fix your DNA or can actually help to get your liver back online and things like that. A lot of people think, okay, yes, it can do something for the muscles and for the bones and for the joints. Yes, it can do that too. But if you go to a competent Skeena practitioner and get a series of treatments there, it actually can help you to heal. But I'm not allowed to say this, am I? I'm not quite sure. The latest thing is biophotomodulation. As I said before, you apply light. And again, it goes into the skin and it goes deep into the skin. So deep that the cells that are within that beam increase their ATP production, because when you have got an inflammation, the ATP production is greatly decreased. So this tool like this can actually help this, and in a relatively short time. But again, action is needed by the patient, change of the workplace, shopping, eating, drinking, all the habits basically need to change in order to foster the healing process within the body. So with the Rife machine, you can do detoxing there, but you can also do killing of viruses, bacteria, and parasites. And for that, you best take a plasma tube there, the ones that I showed before. The picture here, that is a scalar from Spooky 2, and the scalar is quite a powerful one. It can emulate medication. You can put them in the beams on top of the machine there. But I mention it because not long ago, peptide programs have come onto the market. And these peptide programs, they are best applied with a scaler or with a remote.
What's a
And they,
peptide program?
yeah, a peptide is basically a small protein. So you have amino acids and you
Yeah.
chain them together in a chemical process. You get a peptide if there's up to, I think, 100 amino acids chained up. It's called a peptide. And if it's more than 100 or more than 200, then it's called a protein. So peptides are small. They are used in the human body to send information between cells. And peptides, they are short-lived, but in the
Right.
short time where they run through the body, they kick off other peptides to pass on, like in a relay, pass on the information. And when we use, I don't know how long it takes with the spooky too, but from other devices we know when we kickstart peptides, they're sometimes 2 to 3 days measurable after the treatment. So there's a wave, a cascade going throughout the body. And these
Right.
peptides, they actually stimulate the self-healing process and bring the body back to now we're doing the right thing before we haven't been doing the right things. And that also helps, of course, with the neuroplasticity because peptides are neurotransmitters are also peptides. So, and if you stimulate the body to produce and use other neurotransmitters, then of course the whole neuroplasticity process is actually starting. So that's fairly new and is well applied with remote and with scalar. And the number of programs is, I think, meanwhile, up to 1,400 or even more different programs for all sorts of diseases, for all sorts of um, situations where you can use them. There's a fantastic way of doing it. It doesn't have any side effects, and it's basically a stimulating program there. As before, we only had killing and healing, like detox is a healing or a healing itself. Um, of course, you can remove or emulate medication with a plasma as well, but this is fairly new, stimulating the body to do the right things on its own.
Wow.
So, scanner is neuroneuromodulation there. And here we're talking about zones. And a lot of this has to do with reflexonic zones. And when doctors here in the Western world reflex zones, they roll their eyes because they think about hand reflexology and sole of the feet and things like that as it is practiced with by non-medical people. But in Russia, where this device actually is produced, the neurologists get a education in reflexology as well,
Wow.
because it's a huge part. It's far more serious than it has been done in the Western world. So it's quite. So we're talking about zones. Yeah, you can treat where the pain is. Yeah, that increases the endorphins, it increases neuropeptides, and leads to a pain relief. But if you then work on areas that we call general zones, then you stimulate neuroplasticity and you stimulate sanogenesis, the self-healing process. And this term is far too less used in medicine. Nobody's interested in sanogenesis, but I am, and people who produce these devices and Rife machines and so on, it is important, um, an important goal that we're setting the patients to reach.
I like that word, sanogenesis. I've
Yeah,
actually not heard of that word before, but obviously it means self-healing
yeah,
because that's really,
yeah,
I'm, as a healer, that's completely what I'm about. Of
yeah,
course, we need support. and in certain areas, and especially if your illness is chronic. But at the end of the day, you are your own healer, you are your own doctor, you are your own medicine, you are your own psychologist, psychiatrist, you are your own, yeah, your spirit, and we have
Yep.
to get back to that. And it's so
Yep.
true. Look
And
within. Answers
you're
are within.
part of a community, and that
Yes,
helps, and things like that.
absolutely.
Yeah. And yeah, xenogenesis is often used in Russian literature as an aim they want to achieve.
I must say, I'm liking the Russians a lot more than I used to. They're coming up with a lot. Not that I ever disliked them, to be perfectly
Sure.
honest. Let me just make that clear. But I just want to say that I'm for some strange reason, I'm seeing a lot of stuff on my YouTube of what the Russians are doing, just with
Mhm.
technology and stuff like that, similar to this I've been
Yeah.
seeing coming up lately. And that you mentioned this now as Russian technology. I mean, that
Well,
is powerful technology. This is powerful
see,
technology.
yeah. In the 1910, 1914, around about that time, the Americans actually got struck by the Flexner Report, which was an examination of the medical schools at the time. And the recommendation was to only let those schools operate who prescribe medication and are connected to a university. And that has the effect that between that time and 1940s, 46, 47, um, a lot of medical schools that did all sorts of things, amongst others, energy medicine, were closed down and everything went into the biochemistry. The Russians didn't have that problem. So they
That's
have had a
shocking, Jörg.
huge, huge advantage in learning and doing something in the way of energy medicine.
I have to, Dr. Jörg, I have to just ask you about this. You said, is it the Flexner report?
Yes, the Flexner report. And I think Anton Flexner, Flexner. He was the brother of the guy who was running the, I forgot the name. It might come to mind. The thing was that Rockefeller ordered an investigation through that institute where the brother of Anton Flexner was the boss. And he came back with his report, and that was widely accepted by, I don't know, Senate, Congress, or whoever decided at the time. And that closed down, I think, from 140 or so medical schools at the time. I think they ended with just 55 30 years later. That was the
What,
Flexner report. You can
what
read
was
that
the
up
problem?
anyway.
What was the problem that they were saying with the schools that they were closing down? I mean, I get that the medical mafia, Rockefeller was obviously at play, yeah? But
Yes,
I'm interested to know what
he
they
was
said was the problem.
he he was the inventor of the whole thing. He had all these byproducts from his chemical processes and wanted to use them. And so he was it Carnegie Foundation? I think it was Carnegie. It's got that institute that did things like that. The guy, Anton Flexner, was a teacher. He was not even a medical doctor, but he was very fond of the German educational and university system. And he made the recommendation, and that was clear from day one, without examining the schools, must have been a goal, that you need to be part of a university. And number two, if you're doing quackery, then you were not recommended to left open. And the thing is, it started, I think it was the 1890s, that they treated patients with mercury for infections. You might have heard about this.
Yes.
And the doctors, all the other doctors who didn't use mercury, they called them quacks because it's quicksilver. That's where it's coming from. So the guys who were using mercury, who were using biochemical medications, they were the quacks. And look how it is today. They just turned it around. You are a quack if you don't use mercury. That's where it's coming from. Yeah, it's
This is
interesting.
insane.
It's interesting
I,
reading actually about the Flexner report.
I would love to actually go more into that with you in one of our future shows, because
Yep,
this is such important information. You
yep,
know, we deal with this a lot on this channel. You know, we
yep,
have Jerry Marzinski on, who's the medical, he's the mental, you know, healthcare guy. Also spent years working in these extreme mental facilities for the criminally insane and stuff like that, and
yep,
especially with schizophrenia, and
yep,
has really understood that schizophrenia is not voices in the head, it's entities that
yep,
attach to the body when trauma, etc., has been part of someone's life to a great extent, right? And just continue such. And also how the medical mafia has controlled the industry, how the side effects of so many of these medications, suicide is a side effect. Okay, we'll just take it anyway, you know. But it really is exactly what you're saying, how the Rockefellers came in and completely absolutely shut down everything else, started the whole medicine, as I call it, the medical mafia, and
mhm,
since then has been controlling everything and shutting down the
mhm.
natural way. You know, if we go back to Tartaria, I don't know if you look, you know, you follow Tartaria information at all, like,
Yep, mhm,
yeah, you know, the times where we used water facilities to heal. You know, the
mhm,
organ in the church was used as sound healing.
yep,
Crystal bowls were used as sound healings. You know, sound was the way we healed. So all of that has been quashed
yep.
to make place for exactly what is here. I would love to actually look further into that. The
Oh, yep,
Flexner,
we can do this.
very interesting.
Yep, we can do this. That's not a problem. There's a lot to
Yeah,
say about it. Yeah.
yeah.
So another tool, as I said, is the laser, improves the ATP production and modulates nerve conduction, so you can get a pain relief. You can actually treat, for instance, your gum with laser, and then the dentist can take the tooth out without pain if you treat it for a few minutes beforehand. It's amazing what you can do. And as I said, it penetrates deep into the body. It's a fantastic tool. So, one of the things that I do, I've got a lot of clients all over the world. And of course, I can't use the tools I just showed unless they have got a spooky themselves. But even if they would have a scanner device there, it's sometimes difficult to treat yourself on the back and things like that, unless you've got a partner. But what I can offer the people is actually to do an energy scan. And it's now called an Energy for Life scan. In the past, it was known as Nutri Energetics scan. And I can do this online because we use voice or the vibration of the voice to analyze the human body field.
Yes, it's so
And that
important.
in that way, we get information about the energy distribution, gives me an idea where to best start a treatment. Um, and we also have, I got just to back these little bottles there. These are energy drops there. We call them infoceuticals because they convey information and they can replace missing energy and can be sent out in most parts of the world. And yes, it can be done for voice analysis. And it checks the organ system, meridians, mind-body connection, nutrition, minerals, immunity, and so on. It doesn't give us a diagnosis in the conventional sense, but it tells me where energy is actually used and where it should be used, and then we can balance it around a little bit to make people feel better.
Wow.
So that's what I wanted to convey in this whole thing. I hope it wasn't too technical.
We love a German with a sense of humor.
And here are my contact details. So if you have got any questions, then of course feel
Wow.
free to contact me.
Thank you so much. What great information you have. And it's so true because I'm watching what you talk about things, in terms of the nervous system, etc. And what I do is I read the human energy patterns. So I see the patterning, the way
Yep.
their frequencies. It's like I literally like the gift I have is I call it X-ray eyes. I see the blockages in the body, so I can see the patterning of where the illness began, what's
Yep.
caused it somatically as well as spiritually, what disconnection, and then it's amazing how that then creates exactly the same issues within the nervous system of the body. I
Yep.
love that. Be very
Yep.
interesting. Yeah, so interesting. Wow.
Yeah. Well, I sort of recently came across the astrophysicists and the energies that they have discovered or postulate there might be. A huge amount can't be explained yet.
Yes.
But the similarities between the universe and what's going on inside the body is sometimes so mind-blowing.
As
It's
above, so below. That's the
yeah,
thing,
yeah,
As
yeah,
within, so
amazing.
without. It's so
Yeah,
true. We have to
yeah,
see that. And,
yeah,
we have to realize that as long as we're poisoning the earth, we're poisoning ourselves because her stones and bones is our stones and bones. The stones of the earth is the bones in our body.
yeah,
The blood in our body is the rivers on the earth. We've got to
yeah.
realize that every part of in fact, I'm busy writing a book on that now. Very
Oh, good.
interesting. Yes.
That sounds interesting. Yes.
Yes, absolutely. Very interesting. Because the body is so important. We look at our teeth, they're crystals. Every part of the body has crystals. All the major glands, your body has crystals. You
Yeah.
have
Connective
elements
tissue.
within the body. And
Yeah.
we've never been taught this, and it's time that we start teaching people how important this body is and
Yeah.
what a precious gem this body is. It's not just a meat suit, it's the
Hmm.
universe in flesh. And we
Yes.
have to realize that. That's how powerful we are. We're
Hmm.
not powerful in sense of how big our muscles are and how much money we have and how many people we can kill in a day. We are powerful because we have the ability to create. We have such a magnificent force living within us. We have the
Yeah.
ability to create perfect conditions for ourselves, and not through fuckery either, through spiritual attunement and understanding how important and how
Yeah.
valuable we are. Then we get to experience
So
that.
true. So true.
Yeah, well, I'd love to talk further on that as well. But I think
Yes.
maybe the next show, which is in a month's time, we will maybe look into the Flexner report. I think that
Yeah.
is a really, really important thing to look at, because we can then understand further, just in another direction, how our health system has been compromised in the worst, most deceitful way. I mean, that is so disgusting.
Hmm. Yes, I'm happy to talk about this. Not a problem.
Wonderful. Well, then we shall do that. Dr.
Okay.
Jörg, thank you so much. I so appreciate you. Is there anything else you maybe just want to say in closing? And I know that you've popped up your contact details.
Yep.
But is there any, maybe we'll just pop your banner up here as well. But anything where people can get hold of you, anything else? I know you, as I said, you've given your
Uh,
details, but
uh,
anything else from you?
the idea of giving the details is if people have got questions, want to discuss their personal issues, then yes, of course, I do consultations all over the world. I'm always happy to help where I can, and bringing their disease into perspective and showing them ways to how to get out of it.
And I think it's so
That's what I
important what,
want.
sorry, I didn't mean to
Yeah,
interrupt you. Carry on.
no, that's okay. So that was it.
I think it. I think it's so important what you said, to bring your disease into perspective. I always say dis-ease is really your body is not at ease. And we have to find out what has created the dis-ease or the
Yeah.
imbalance to begin with, because healing is really bringing your body back into balance. You've never been broken. You're not broken. You need to bring yourself back into balance. And yes, we have to change spiritually, emotionally, mentally, and physically. We have to change our diet if we've been eating and poisoning our body in the wrong way. We can't deny that. There's a whole lot of change of lifestyle that goes along with it. And often I think that's one of the reasons why people don't want to change, is because they don't like to change their lifestyle, right?
Yeah.
Amazing. I don't know if you've ever heard of her. I actually had her on the show a couple of times, Dr. Zandre Buerta. She was known as South Africa's blood doctor when the COVID pandemic was on. She was testing the blood and showing you what your blood looked like before the jab and what your blood looked like after the jab. I mean, every time I had her on, my show got struck. So I was always struck, but I mean, obviously very valuable information. Her son was born with one of the rarest cancers in the world. I think he might be one of a handful, literally one handful of survivors. He was born with this. She dedicated her life to saving her son's life through diet and through understanding how the body works. This boy is a great big strapping 6'8" youngster today. I cannot tell you what it is to see. And she just says, if you want to change, you have to make it. No, he can't eat gluten. No, he can't eat cupcakes at a birthday party. No, you have to, as a parent, be strict enough to say, absolutely not. My child's life is much more important. And very soon, the child adapts to that food and that way of life. We must never forget that. As parents, it's our limitations mostly that we project onto our kids. It's our shit we project onto our kids, and then our kids make it theirs. Really, that is my opinion. So
Yeah.
if healing, if there's some ailment or illness in your body that you think is absolutely unhealable by the medical fraternity, as I call bullshit on that, because we're hearing more and more how they don't want us to be empowered and how they don't want us to understand how the body actually works and that it is your most perfect instrument.
Yeah. I agree with that. They could do much more, but it's a good business model for them. And certainly people
Right,
in the company there who have got different ideas, but yeah, that's how it is.
right,
Plus,
absolutely,
you don't have to buy into it. There are other
exactly,
possibilities.
exactly. And it's so
Mm,
good to have people like yourself out there, Dr. Jörg, who are sharing your knowledge and willing to talk to us and let us know what is going
yeah,
on. You've got both sides of the coin. So once
yeah.
again, I appreciate you. Thank you so much for being here. And we'll see each other in a month's time again. Take care,
Okay.
everybody. Thank you so much for watching. God bless you all, and see you later, alligator. For those of you watching, yeah, see you next time. Cheers, guys.